My name is Christopher Kang'ombe, Member of Parliament for Kamfinsa constituency in Kitwe. First of all, I'm delighted to the organizers of this very, very important program that allowed us to come and learn about the EPI, which is the expanded program on immunization. As a lawmaker who's also responsible for budget approval, I got so interested after the presentation that we actually are not putting in enough money in EPI. And I'm also interested to learn that we have partnerships that have done their part. CHARS and all the other stakeholders that have been participating in programs of healthcare have done their part. In terms of co-financing of the immunization program, I think that we now need to step in at a slightly higher level, at a slightly higher scale. And my message today, I think, is that we will do more as Parliament, but we also need to raise our voice in terms of having the right partnerships. We learned yesterday, for instance, that we may not have the same level of funding we've been having over the years, because now years have passed. Zambia will be treated as a country that by now should have acquired capacity. So it's a wake-up call, but also I think the structure for the EPI, which is the expanded program on immunization, currently shows that in the establishment we have over 20 vacancies, meaning we need to employ people in all the 10 provinces to be able to do what is expected to be done. So simply put, this has been a great program for me. I will champion this agenda in my own individual capacity, but also through my work as a parliamentarian. So I want to wish every stakeholder success in their individual efforts, which ultimately should lead to a national effort to improve funding and also support to the API activities. I'm very grateful. In terms of my views on the resolutions that we passed after this very, very important training, number one, I was emphasizing a point that we attend so many trainings, we attend so many programs that require capacity building. Now, if you don't have a team that remains to run the program, you end up having a situation where resolutions are hanging, no one is implementing anything. So one of the resolutions we've made is that we obviously need stronger voices. Now, how do we get stronger voices? We need a caucus. We need a platform where when anything to do with immunization has to be advanced, MPs will be able to say, let's meet, how far are we going with these activities, and then we fast track them. We've also resolved that we can't always rely on donor support for funding of our immunization programs. We need to find a local solution. Do we train our people to be able to manufacture vaccines? Do we go to the private sector and say, tell us what environment we need to provide so that you are able to do the manufacturing? In short, the resolutions are very clear. What we need now is a team that will run with those resolutions so that ultimately we're able to get results out of the resolutions. It's been a great training. Yeah, so one of the pledges I want to make in my capacity as Member of Parliament is obviously in relation to getting all the children to be VIPs, vaccinated, immunized and protected. Meaning we need to vaccinate our kids, not just those that are in the urban setups, but also those in areas where we believe that there's more needs to be done. We need to immunize them. We need to protect them. Now we need to raise our voices. I need to be an advocate, and I'm pledging that I will be an advocate for VIP, which is to get more children to be vaccinated. I think one of the lessons we've picked from the training we've had the last 2 days has been about how we have got so many children that miss all these opportunities for vaccination. Now here's a problem with that. If one child in a community is not vaccinated, or 3 or 4 are not vaccinated, when there's an outbreak of a disease or a virus or something of that sort, we get to have those who are vaccinated being exposed again, because we still have many numbers that are not vaccinated. So I want to be an advocate. Coming from Kitwe, a place of 5 constituencies, I know the numbers there in terms of gaps, in terms of those that we have not vaccinated are still very high. And I hope that we can do more as advocates, and I'm committing myself to be an advocate for this program.